Good afternoon, dear colleagues. Today we begin to study propedeutic pediatrics, and our first topic is the period of childhood. Now on the screen, you see the plan of our conversation. We will consider the following issues: topicality of theme, classification of childhood periods, and characteristics each of them. Knowledge of the features of the period allows you to assess the correct growth and development of the child. Also, the peculiarities of certain age period determines their features of care, nutrition, upbringing, etc. Also, age features of pathology allow to develop preventive measures. Now on the screen you see the classification of periods of childhood by Professor Gundobin. According to this classification, whole childhood period divided into two big phases: fetal stage and postpartum stage. In turns, fetal stage consists of two parts: phase of embryonic development and phase of placental development. Postpartum stage consists of period of newborn, infancy, calf's teeth period, primary and secondary school periods. At this scheme you can see distinctive features of different periods, like body proportions, physical developments, and so on. But they are not only features, there are a lot of peculiarities in different systems and organs in different periods of childhood, and we will study them during our future course. So, first is phase of embryonic development, which lasts from conception to 2 months. In this phase, external body parts and internal organs are formed. Possible pathology at this period are embryopathy, the most root anatomical and dysplastic defects of organs. Next is phase of placental development, which lasts from 3 months to birth. At this phase, differentiation of tissues and organs of the fetus take place. Possible pathology at this period are fetopathy, which means delayed growth and differentiations of organs, or dysplasia, cirrhosis, fibrosis, intrauterine malnutrition, and so on. Newborn periods last from birth to 3-4 weeks. All organs and systems are adapting to new living conditions. The small circle and respiratory organs begin to function. The child switches to enteral nutrition, and the immaturity of all organs and systems take place. Possible diseases at this period are embryo and fetopathy, birth trauma, infections disease. Period of infancy lasts from 1 month to 1 year. It's a period of very high physical and neurological development, high intensity of metabolic processes, formation of second alarm system like language, but at the same time propensity of diffuse inflammatory reaction and functional weakness of the digestive system take place. Possible pathology of this period are anomalies of the constitutions, cramps and meningitis, dyspnea, hypertrophy, rickets, predisposition to infectious disease and septic conditions. Early children's period, a part of calf's teeth period, lasts from 1 to 3 years. It's a period of gradual improvement of all systems of the body. Intensive development of intelligence, complications of labor activity, ability to abstract perception. Improvement of second alarm system and immune response, and increasing of number of social contacts. Possible pathology of this period are acute infectious disease like measles, chickenpox, scarlet fever, and so on, and acute respiratory infections like rhinitis, otitis, pharyngitis, bronchitis, and so on. Preschool period is the second part of calf teeth period, lasts from 4 to 7 years. The most distinctive features of this time are differentiation of the nervous system, maximum development of the thymus, and predominance of the pituitary gland. Possible pathology of this period are also acute infections and acute respiratory diseases and psychopathological reactions like neurosis and protest reactions. Next is primary school period, which lasts from 7 to 12 years. At this period, the morphological differentiation of cerebral cortex cells finish. This is a significant increasing in muscle mass. Children acquired such traits as agility, speed, strength, endurance. And this is a period of predominance of hormones of thyroid and gonads. Potential pathology of primary school period are endocrine dysfunction, chronic diseases of different organs like heart, kidney, and others, impaired posture, and pathology of organs of vision. Next period in our list is secondary school period or period of puberty. It starts from 13 and lasts to 15, 16 years in girls and 17, 18 years in boys. The most common features of this period are shift in the endocrine system with the predominance of functional activity of the sexual glands, development of secondary sexual characteristics, body structure and anatomical physiological features of organs, acquired features of adults, and intensive psychological development, formation of freedom, consciousness, citizenship, and morality. Possible pathology of secondary school period are psychoneuroses, functional cardiac disorders like functional cardiopathy, vegetative system dysfunction, endocrine glands dysfunction, defects of sexual sphere like amenorrhea, dysmenorrhea, and chronic disease of gastrointestinal organs like gastritis, duodenitis, peptic ulcer. Dear colleagues, we have completed the study of the peculiarities of childhood. Thank you for your attention.